Thank you very much for invitation and allowing me to present this case of successful introduction of PrEP in challenging communities, which I believe Poland could present one. So firstly, we know that PrEP has a significant influence of new diagnosis, but the evidence base shows on population level that this is mainly reflecting to gay and bisexual men. However, for women and who acquire HIV heterosexually and people who inject drugs, this is not being so spectacular. Also, at the same time, we know that hetero and sexual mode of HIV transmission and injecting drug use is the main mode of HIV transmission in Eastern countries and many Central European countries. We have performed some analysis of access to PrEP in this area, and we know that mainly the PrEP use is informal. There are no country-sponsored programs on a population level, so it is access that is being, injecting drug users are left behind. So that's my case referring to. Firstly, I would like to present Eva, and her partner is HIV positive. He has mixed drug abuse and he's not on antiretroviral treatment. She had unprotected sexual contacts with him. They are not using any conception, or they are not using condoms. And he also insists to have unprotected sex with her continuously. And as I specify, it is quite common for addicts to manipulate loved ones if it means they can get resources. And I think also sexual contacts could be manipulated in this way. So she feels a codependent person, and it's very difficult for her to take the lead in the relation. We also know from a published recently work that top 3 barriers perceived for prescribing PrEP are not enough knowledge, lack of experience, or that they are not covered by insurance. So in case of Eva, those were the 3 ones. And what about her partner, Adam? He's heterosexual man. He's using mixed substances. He's HIV and HCV positive. You can see some of his results here. He has been attending HIV clinic, but only occasionally. He was lost to follow-up. And that's also a case for him that he got HIV infection probably mainly through heterosexual contacts, because he was mainly dependent on non-injecting illicit substances. So injections were very occasional, and he was mostly using the exchanged equipment. So it is also a case for him that he did not have any PrEP access. And you can see from this work by Susan Sherman that only 1/4 of people who inject drugs had heard of PrEP in the study from US, from Maryland. But most of those who heard were interested in taking it. So we need to do better in approaching people, also injecting drug users, because sometimes their HIV comes from heterosexual contacts. So what about Adam and Eva? Because we are interested in a couple more than just in individuals. Adam shows in 2015 for care after detox. He rethought all his life and he wants to start treatment. He's still addicted, but dose is mainly tramadol and alcohol. He's not having very high viral load, which is also a good news for his sexual partner. However, he's still detectable. And he told me that his partner, Eva, she is now 12 weeks pregnant. He still insists to have sex without condoms with her, and she agrees irrespective of being pregnant. So what did we do in this case? Firstly, we saw them as a couple. We put Konrad on OST program. He accepted it and was attending. He started regular meetings with psychologists. He started CART, of course, immediately, but since he was still detectable, he got undetectable within 1 month. However, he continued harmful drinking, which is very common for people who are on OST to continue some of their addiction. So what we did for both of them, the couple was consulted repeatedly, and I insisted to have them both in my cabinet so they would have the same information put in the same way. That's in my understanding and in my practice, this is extremely important to consult a couple, not a single person's. Because Conrad was detectable and we didn't know how it go with his adherence, we put Anya on PrEP. She was pregnant. We know that PrEP is now considered safe and a possible option for pregnant women who are partners of HIV positive men with uncertain adherence. So we did that. We involved also the environment of the couple. So we invited Conrad's mother, and she was very open to help to care for him and for a family. It helped a lot. And in result, Anya delivered a healthy boy. So that is when we could say it was a successful PrEP story. But I'm very far from saying so, and that's why my presentation has this successful in brackets, because we know that drug dependence is far more going beyond just having a healthy partner or a healthy baby. It is how to repair a relationship broken by addiction. Addiction is a family disease, and I wanted to present it with a strong picture made by police from, I believe, LAPD, showing a pigeon nest that was organized in left syringes by an addict group. So it's definitely not the best example for nesting, but people would have, of course, families, even if both of them are addicted. And we need to consider this as a wider case. It's not only PrEP, it's also involving those they depend on, which means families, for example. And it is ongoing and important and neglected part, because if you look into the studies we've done in ECE network group, people who inject drugs, women, pregnant women, and sex workers, they are they are a vulnerable population and hard to reach population across the whole HIV continuum. So also testing, it's very difficult to test them. And if we don't test them, they don't know, they are not aware that they have infection and can transmit it. And then just a couple of words on where do we go, because I think that we are now transferring into a fantastic time for PrEP when we would have, in addition to oral PrEP and different oral PrEP strategies, we would have cabotegravir coming maybe to the field and some other investigated agents. And we've heard during this year's virtual IAS that cabotegravir is really getting a good result, but it's only MSM and transgender that was not introduced, the idea to injecting drug users and other populations. And the other populations I want to mention is non-MSM, so it's heterosexual couples and especially women who are presenting worse adherence. They have different pharmacokinetics, and we need more studies in this area to also offer people at need who are heterosexual, offer them adequate PrEP. So as I mentioned, it's also it's all about other population that needs to be developed, and I really like the way IAS USA summarized that by saying that identification of individuals for whom PrEP is indicated requires individualized approach. And I would like to highlight that individualization because it requires understanding of people needs, and it requires that people understand what is needed for PrEP to be effective. And with that, I would like to thank you very much and wish you good results in taking care of couples and taking care of families, not only seeing them as individuals at need for PrEP.